So whooping cough or pertussis, which is the sort of medical name, it's a bacterial infection caused by an organism called Bordetella pertussis, and it is a respiratory tract infection. It spreads via respiratory secretions, which means that it can be either respiratory droplets of when someone coughs or sneezes, but also aerosol particles. So smaller particles and bigger respiratory particles. Pertussis is very contagious, especially if if the infected person is in contact with vulnerable people. So as we're talking about people who have weakened immune systems, people who have not been vaccinated. You can have general respiratory infection symptoms like sneezing, not feeling well, maybe even having a little bit of fever, and a little bit of a mild cough. And that can last for the first few days. And that is called the guttural stage of the disease, or the earlier stage of the disease. Then you move on to the classic stage, which is what gives whooping cough its name. And it's when you have more frequent episodes of cough that tend to be frequent. The way that we treat whooping cough is with an antibiotic, which is a viral infection. It is very important to diagnose it as early as possible, because if treated after 1 or 2 weeks of symptom onset, then the treatment may not be as effective. Vaccination is the most important way to protect your child against pertussis. And there is different stages in which vaccination is important. Vaccination against pertussis is through that we have 2 available vaccines in the US. One is called DTaP and the other one is called Tdap. And the difference between the 2 is the age in which we give it. DTaP vaccination is indicated for children younger than 7 years of age, and Tdap, which is a different version of the same vaccine. And then every 10 years, you're supposed to get a booster with a Tdap throughout the rest of your life. So vaccination is an ongoing strategy to continue to prevent this kind of infection.